Some Louisville health officials are concerned about hospitals reaching capacity with an increase in COVID cases. WDRB's Lexi Ratterman tells us what hospitals are seeing right now. Lexi?
As COVID-19 cases jump up in Louisville, city officials worry about hospital capacity. We spoke with Norton and UofL hospitals this morning who say they're not close to capacity yet and they have plenty of beds available.
What we are continuing to encourage is if you have had your full vaccination, both of those vaccines and the booster, that will help all issues for capacity, for any future capacity issues. We are not seeing capacity issues at this time.
Yesterday, Mayor Fischer and Health Director Moyer sounded the alarm on hospital capacity concerns as the Louisville community hit over 10,000 cases of COVID over the last week. Hospital officials say they're not seeing a huge spike in admitted COVID patients to go along with that case spike just yet. In the Norton healthcare system, officials say they are seeing an influx in testing, but not necessarily a major increase in COVID patients being admitted. It's a similar story at UofL health hospitals. Officials there say they're seeing a steady increase in COVID patients right now in the ICU, but they think it will get much worse before things get better.
I don't think we're in crisis yet. I think, to be honest with you, we faced worse situations of the healthcare system than we're currently facing during this pandemic. I think that being said, the biggest worry people have is that, we're not at the peak yet. We're going to continue to increase the number of admissions, the number of positive tests, the number of staff out.
UofL Health says staffing shortages will become a huge concern in the coming weeks as we reach the peak of cases in this surge. Currently, they have about 400 employees out across its entire system. That's out of about 12,000 employees. Overall, both hospitals say they have surge plans in place and they're ready to use them if needed. Lexi Ratterman, WDRB News.